So you should, and once again, there are a couple of paragraphs on declarative memory or explicit memory and non-declarative memory, implicit memory. Take a look at those. It really is kind of neat. I want to wrap up with one bizarre event. The story of HM. Anterograde and retrograde amnesia. Have any of you gone in for like major surgery where they put you out and cut you open? Okay. They gave you a drug that's an amazing drug, Versed. Why do they give you this drug? They tell you it's a pre-anesthesia. They give you two things with your pre-anesthesia. One is a drug that's going to kind of ease you into nirvana, okay? You are going to be one with the universe at that point. And they give you a Versed with it. And then they give you all sorts of really high-level octane to take you to Mars and back. And what Versed does for you is something really amazing. It prevents you from forming short-term memories. If you can't form short-term memories, what else can't you form? Long-term memories. Cool. Why do they give that to you? Because we're essentially individuals. Every one of us is different. We all metabolize these chemicals at a different rate. Our livers, our kidneys, our metabolism in general varies. Therefore, when they give you anesthesia, they want to give you just enough anesthesia to do two things: control pain and prevent you from moving, typically. Anesthesia, in a lot of respects, is a controlled death event. They want you to hover somewhere between where you are and death, closer to where you are, but not very close to death. I happen to be the kind of person that metabolizes anesthesia fast. I've woken up during 3 surgeries, all with different surgeons, all of whom had different kind of responses. One surgeon said, so, Mike, what do you think of the surgery? And it's like, oh, there's a story here. Please share it, because you were the person cutting into me. He goes, you don't remember me opening you up and you sitting up saying, we need more anesthesia? I said, thank you, Versed. Not a memory, okay? I was there for the event. I started to form a memory of the event, but the drug induced retrograde amnesia, which is why once they start giving you the drugs, the pre-anesthesia, you should never have a discussion with anybody about anything, because you will not remember one word of it. You can answer questions, oh yeah, sure. No memory. So it really is nice. Antegrade amnesia is different. So here's Mr. HM. He had neurosurgery done. I believe it was on some memory pathways in 1953. You're going to have patients similar to him. As a result of his surgery, he lost about, I don't know, 8 or 10 years of previously formed memories. Okay? These were memories that he already had in long-term memory, but he could no longer have access to them. And as of his surgery in 1953, he could no longer form memories. His short-term memory was ablated, was gone. No new memories. So you walk into work with your patient. You go, hi, Mrs. So-and-so. How was breakfast this morning? Oh, they never gave me breakfast. I don't know what's going on. Oh, okay. Well, you remember what we were doing yesterday? No, did you come in here and work with me? I said, I don't think you did. All right. So what do you have for breakfast, June 2nd, 1948? Well, I had scrambled eggs, and boy, my daughter came to see me, and yeah. This, by the way, is a common geriatric problem. You're going to have those patients, can't remember what went on today, can't remember what went on yesterday, but 15 years ago, they can tell you with excruciating detail what happened. And that's what happened here. Mr. H.M. was stuck in 1945. Perfect memories, 1945. Perfect memories, back to about 1928, 29. You notice that blue area in there from 1926 to about 1929? You all have that little area of blue memory. Your earliest memories are from about the age of 4 or 5. Any memories that you have that are older than that are false memories. They're memories that you have as a result of talking to your parents or your siblings. We all have those memories of, yeah, you know, I remember when I was 2 and I want you to think to that memory that you have when you were 2 or 3. You're not watching them through your eyes. You're watching yourself do something. And I hate to tell you this, you can't do that. It doesn't work. Real memories are always what you see versus seeing you doing something. Yeah. So that infantile amnesia is important. You know, that's like taking Versed. You don't want to remember pooping in your pants all the time. 20 poop events? No. You don't want to remember trying to stand and falling 64 times a day, hitting your head, doing all these things. You don't want to remember the first time you met Bozo the Clown and he scared the crap out of you. All right? Could be Santa Claus. Have you ever seen what happens when little kids first meet Santa Claus? They scream. First Halloweens. It's a nightmare. It's terrible. We don't want you to remember those things. All right? Retrograde amnesia is losing memories you already have. Retrograde amnesia almost always is due to some form of trauma and or some form of drug. Anterograde amnesia is almost always due to some form of trauma. Surgery in the brain is trauma. So, yeah,
Can you repeat the retrograde again?
Retrograde is either going to be due to trauma or to a drug that's given to you to induce retrograde amnesia.
Okay.
But it's going to lead to a loss of, in general, memories that you have formed or should have formed. So amnesia, where somebody has lost their past, that's retrograde. Versus anterograde is making new memories. The movie. Oh goodness, the guy who has amnesia and he has to solve his wife's murder or something.
Butterfly?
No what?
Memento.
Yes. And the problem is he has both. He has retrograde and anterograde. So he has to keep leaving him. When he has those moments of lucidity, he has to write things down for him to make use of. They did a really good job of that, by the way. It's scary traumatic. Especially when you learn about the brain, it's even worse.
There's a movie, the 50 Days. Yeah, 51st Dates.
51st Dates, yeah. But that's a romantic comedy, right? Yes. Okay? That's not meant to be entirely serious. Yeah, there are all sorts of movies involving amnesia. Amnesia's it's a great form of entertainment. Sure. As you get older, as you get stressed, okay. How many times have you been stressed, like walking in to take an exam, and you got to do something, you think, oh, what's the word? And you can't recall it. That's a form of retrograde amnesia. Okay? You've got the word. The word is in your brain, but you can't get to it. Memories are like street maps in your head. You've got this map in your head. You don't know the map is there. Okay, it's like you have your little GPS turned on all the time. You've got to get to that back corner to find something, and you do it. But during periods of stress, during periods of trauma, you can no longer get there. PTSD. There we go. All of you will have will have patients with PTSD. Okay, we have a PTSD generator right now. All right, we got these wars. First World War is called shell shock. It's PTSD, post-traumatic stress disorder. It's it's there. Memories do not get erased. Access to them is denied. Traumatic events can prevent your access to memories. We see this with rape frequently. Rape prevents access to certain memories. In war, your best friend was just blown up standing next to you. You forget it. You wipe it out. But what you've done is you've wiped out the memory, but not the trauma associated with the memories. So this is, memory is really important, okay? So I would just like you to take that, I'm sorry, that's where I was supposed to start with this today, instead of ending with it. But that's what's on the exam. What?
What about drawing today?
Yeah, you'll have drawings on the exam too. I'll put your 2 extra drawings on the exam. Okay? No, I'm not going to have you draw today. Okay? I don't have something ready for you. I don't want to spontaneously do something. I need to be prepared for it, just like so. But before you go, what other questions do you have? You gonna be ready?
Actually, I just wanted this. I noticed with the table, the substance P, it says it's excitatory on the table, but
Yes.
on the diagram,
It says inhibitory. It can go either way. It can go either way. Substance P tends to be excitatory, and it tends to excite pain. Yeah. Which is, yeah. So I would not. If I give you a question on something like that, I would more than likely